What is aplastic anemia? It is the failure of the bone marrow to produce cells. It is an autosomal recessive disorder. It's characterized by bone marrow aplasia and pancytopenia, which is decreased number of all blood cells. The most common is Fanconi anemia. How common is aplastic anemia? Aplastic anemia is a rare disease that occurs in only 1 to 2 people per million each year. That's 300 to 600 new cases across all age groups in the United States. Risk factors of aplastic anemia is exposure to environmental toxins, viruses, myelosuppressive drugs, and radiation. The most common symptoms of aplastic anemia are below. Low levels of red blood cells can cause pale skin, chest pain, irregular heartbeat, enlarged heart. Low levels of white blood cells can cause fevers, mouth sores, infections. Low levels of platelets can cause easy bruising, nosebleeds, bleeding gums, blood in the stool, heavy bleeding with menstrual periods, and other symptoms can include nausea, skin rashes. Children with this disease can also be observed for paleness, lethargy. They can say they don't feel good. They can complain of a headache, a fever, low blood count, a recent upper respiratory infection, and they can also pass out. Complications of aplastic anemia is life-threatening infections from bacteria or fungus, thrombocytopenia, anemia. Late complications includes relapse, paroxysmal nocturnal hemoglobinuria, PNH, or myelodysplastic syndrome, MDS. When evaluating the patient, you want to get the history, the recent illnesses, the medications, exposures to toxins. You want to get the most detailed family history of bleeding disorders, malignancies, or abnormalities. Upon the physical assessment, you're going to look for bruising, petechiae, purpura, oral secretions, gingival oozing, tachycardia, and tachypnea. Diagnostic and laboratory testing, you would run a Guyx stool sample and it will test positive. The urinalysis may contain blood in the urine. Blood testing would be H&H, CBC, and peripheral smear. A bone aspiration will show severe decrease in or absence of hematopoietic cells. Medications and treatments for aplastic anemia is stool softener. It prevents anal fissures to constipation. HSCT from a human leukocyte antigen, matching sibling donor. Immunosuppressive therapy. You're going to have a high dose of cyclophosphamide given if the matched donor is not available. Only when necessary, administer irradiated and leukocyte PRBCs or platelet transfusions. Limits exposure to HLA antigens should the child require bone marrow transplantation in the future. Health promotion and maintenance. The main priority is to keep the child safe. You're going to refer families to Aplastic Anemia and Myelodysplastic Syndrome International Foundation if they have a moderate or mild case. You're going to educate the family and the child. Stay away from people who are sick. Do not eat overcooked foods. Avoid contact sports because that can cause bleeding. You're going to avoid travel at high altitudes. Children with a low red blood cell count will have increased fatigue and need for more oxygen at high altitudes.